Alyssa, and I'm going to be talking to you today about the Mediterranean diet, or what I like to call the Mediterranean lifestyle, and cognitive function. So I picked this topic because my grandma was diagnosed with Alzheimer's disease and later passed away from the disease. So I've always been super interested in Alzheimer's and also, of course, nutrition. So I thought this would be the perfect topic. So a quick show of hands, how many people in this room, either you or your families, are affected by somebody with a cognitive impairment, whether it be dementia or Alzheimer's? And then keep those hands raised. Other people who you may know of, just for those of you that don't have your hands raised. Okay, thank you. So, what exactly is cognitive impairment? So cognitive impairment encompasses a variety of different processes ranging from reasoning and memory to attention and language that really allows us to attain knowledge. So first I wanted to talk with you about the progression of cognitive impairment. So it first starts out with mild cognitive impairment, and mild cognitive impairment does not really interfere with activities of daily living. Then it progresses into dementia. So there are 3 different phases of dementia: mild, moderate, and severe. The more severe the dementia, the more it's going to interfere with activities of daily living. But it's important to note that this interfering with activities during the day does start during the first phase, which is mild dementia. So the Mediterranean diet really is shown to help prevent cognitive impairment. And up until this point, typical components of the diet and specific nutrients and foods have been studied, but a whole diet approach really has not. So the Mediterranean diet is really thought to allow us to see the whole diet approach and how that helps with cognitive impairment. So reactive oxygen species are formed by normal metabolic processes in our body, and antioxidants, which are found in the Mediterranean diet, really help prevent the reactive oxygen species from forming. So unfortunately, the amount of reactive oxygen species that are formed can outweigh the antioxidants that we consume, producing this oxidative stress right here. So typical components of the Mediterranean diet, starting at the top, we have meats and meat products. Also included in this category is sweets. So those are consumed the least. Then we have dairy products, which include yogurt and cheese. So those are consumed about moderately. And then a moderate to high consumption of fish and seafood. And then the highest consumption of things like unrefined grains, legumes, fruits and vegetables, nuts and seeds, olive oil, etc. And then, as you can see over here, in moderation, wine, and of course, everyday water. So my first study is the Mediterranean diet improves cognition in the Pradime-Navarro randomized trial. The purpose was to assess the effects of the Mediterranean diet on both cognition and dementia incidence. It was a randomized control trial. It lasted about 6.5 years, and the total number of participants after those were excluded was 522. So participants were community-dwelling both women and men of Spain. They had to be 55 years or older, and they had to have a high vascular risk due to type 2 diabetes or 3 of the following. So current smoking, hypertension, dyslipidemia, being overweight, or a family history of premature cardiovascular disease. They were excluded from the study if they had current full-blown cardiovascular disease or a previous history of it, if they had any severe chronic illnesses, or if they were illiterate. So the intervention for this study, it was broken down into 3 different groups. The first group followed a Mediterranean diet, and they're also supplemented with 1 liter of olive oil a week, extra virgin olive oil. The second group also followed the Mediterranean diet and was supplemented with 30 grams of raw, unprocessed mixed nuts per day. The main focus was on walnuts, but they were also able to consume almonds and another nut as well. The third group, which was the control group, was the low-fat diet, and really for this diet, just basic education on a low-fat diet was given, and also a diet plan was provided. So a 137-item food frequency questionnaire and a 14-item adherence to the Mediterranean diet was given to these participants at baseline and yearly thereafter by a registered dietitian. So the first test that they did for this study was a clock drawing test. It's a neuropsychological tool that assesses language comprehension, visuospatial abilities, working memory, and attention and abstract thinking. So basically what they do for this test is the person giving the test would ask participants to draw a clock. They would ask them to put the numbers on the clock, and then they would give them a time. So in this case, the time was 2:30. As you can see, those that had mild cognitive impairment or even early Alzheimer's disease, AD, they pretty much have the spacing on the clock fairly okay, but the time is off. And then as you can see in late Alzheimer's disease, the clock is all jumbled up. The next test that they did was a mini mental state exam. And this assesses orientation to time and place, registration, recall, attention and calculation, and language and visual construction. So some examples, the score for this was out of 30. So some examples of questions would be, what is the year, what is the season, what is the date and time, or where are we right now, what hospital are we in, what state are we in, what county are we in, what floor of the hospital are we in. So both the clock drawing test and the mini mental state exam are really valid indicators of dementia and cognitive impairment. So the results for this test for both the mini mental state exam and the clock drawing test. The mini mental state exam for both the extra virgin olive oil group and the mixed nuts was higher than the control or the low-fat diet. Also, for the clock drawing test, the extra virgin olive oil group and the nuts group was also higher than the control or the low-fat diet. They also adjusted for sex, age, education, family history, everything listed on the bottom here. Overall, there were 60 cases of mild cognitive impairment that were diagnosed, with the most being in the low-fat control group with the number of 23. And there was 35 cases of dementia diagnosed, with the most being, again, in the low-fat control group with 17. The diagnosis of both mild cognitive impairment and dementia was done by a neurologist with referrals from the participant's general practitioner. Some strengths of the study: I thought it was a long-term study, about 6.5 years. It was randomized. I thought they included foods with strong antioxidant and anti-inflammatory properties, the olive oil and the nuts, and several co-founders, which were just listed on the bottom, were controlled. Some limitations: the sample size, about 500 participants. Seems like a lot, but compared to the other studies I looked at, that was kind of a small number. It was single-blinded, although there's not much we can do about that in this type of situation. Participants did have a high risk of cardiovascular disease, so we have difficulty pertaining that to the general population. FFQ was self-reported, and the intervention was done at home. So the last two, we're really trusting what the participants say they're doing and what they're actually doing. In conclusion, I gave the study a strong rating. Overall, both the extra virgin olive oil group and the mixed nuts group with the Mediterranean diet showed better cognitive performance over the length of the study, and that allows us to say that there is evidence for protective effects of the Mediterranean diet on cognitive function. So the second study that I chose, adherence to a Mediterranean type dietary pattern and cognitive decline in the community population. The purpose was to assess the association between adherence to the diet and cognitive change in elderly. It was an observational prospective cohort, about 7.5 years, and the final number of participants was 3,790. All of the participants were part of the Chicago Health and Aging Project, so they were pulled from that project into this study. So they had to be 65 years or older, and they also had to have 2 or more cognitive assessments done out of 4 that were done at baseline for the Chicago Health and Aging Project. And that was during an in-home interview. They were excluded from the study if they had a history of heart disease or stroke. So this group also was given a food frequency questionnaire, and these are all the categories that were given. So on the left-hand side, we can see that these are consistent with the Mediterranean diet, and these are not consistent, and then just how many items per category were in each group. So for this study, the maximum was 55. So on the left-hand side, again, all the components. And then on the right-hand side is the servings per week for them to get a score of 5. So the higher the score, the closer to 55, the better that they adhered to the Mediterranean diet. So from non-refined cereals all the way down to olive oil, they had to have greater than this number to be given a 5. And for red meats down to alcohol, they had to have less than this number to be given a 5, since those are inconsistent with the Mediterranean diet. So the results for this, they looked at the global cognitive score, which is kind of a compilation of a couple different tests, and then again the mini mental state exam. So the group with the highest adherence to the Mediterranean diet, scores 30 to 45, had increased both global cognitive scores and scores on the mini mental state exam compared to the middle and the lower. So for this study, they also looked at the rate of change. So this can kind of be confusing, but I'll try to explain it the best I can. So rate of change really just means how fast the output changes, in this case the global cognition score, compared to the years that pass. So both of these numbers are negative, which means the more years that pass, the more decline of the global cognitive score, which we can all assume. The solid line, which is the highest group, or those that adhered highest to the Mediterranean diet, had a larger negative score, which means their decline was more slow, compared to the middle group, who had a smaller rate of change, so they had a faster decline. The global cognitive score went down faster. It's also important to note that this p-value is not significant, and this is. Some strengths of the study. It was a really long-term study. Again, it had a prospective design. They did look at a biracial community sample. Food frequency questionnaires were assessed at baseline and then at 3 years, so about halfway through the study. And then several co-founders were controlled, including hypertension, BMI, cognitive activity performance. And then the limitations of the study were that the food frequency questionnaire was again self-administered to those who were able. And that kind of plays into the Mediterranean diet score and what score they were given. And then the APOE4 genotype. So the APOE gene is really involved in the metabolism of fats in the body, and it controls something called beta amyloid, which is a component of plaques. And so the 4 genotype of this really clears plaques less efficiently, maybe compared to the APOE3 or the APOE2. This topic is very complex, but basically having this genotype really, it's at about 3 to 8 times more likely to develop cognitive impairment. And so basically this genotype clears plaques less efficiently, and the more plaques that build up in your brain, the more likely you are to have cognitive impairment. So that's a big limitation of the study. In conclusion, because of that, I gave it a fair rating. The highest group was significantly associated with that slower decline of the global cognitive change. And that allows us to say that adhering to the diet based on the Mediterranean diet scoring may afford some protection against cognitive decline. So my third study is adherence to the Mediterranean diet and Alzheimer's disease risk in an Australian population. The purpose was to invest the association between the adherence to the diet and risk for both Alzheimer's disease and mild cognitive impairment. It was a cross-sectional study, and the final number of participants was about 970. Participants were volunteers of the Australian Imaging and Biomarkers and Lifestyle Study of Aging. They had to be 60 years or older, and of course, volunteers of the study. They were excluded from the study if they had a history of non-Alzheimer's disease dementia, schizophrenia, bipolar disorder, depression, cancer, or Parkinson's disease. They were also excluded if they had insulin-dependent diabetes mellitus or uncontrolled diabetes mellitus, and regular alcohol use. So the regular alcohol use factored in greater than 2 standard drinks per day for women or greater than 4 for men. So in this study, the score was actually from 0 to 9. So how it worked was they were given 1 point for each beneficial component if their caloric adjusted consumption was above the gender-specific median. So this was true for those consistent with the Mediterranean diet, so fruits, vegetables, legumes, cereals, and fish. They were then given 1 point if their caloric adjusted consumption was below the gender-specific median for those inconsistent with the diet. So meat and dairy products, again, including cheese and yogurt. They were given 1 point if their monounsaturated fatty acid to saturated fatty acid ratio was above the median, and also 1 point for mild to moderate alcohol consumption. So 5 to 25 grams per day for females and 10 to 50 for males. So for this study, they did a neuropsychological test battery. So a battery really just means compilation of multiple different studies. So again, in this study, they looked at the mini mental state exam. They also did tests to assess logical memory, verbal fluency, attention and working memory, executive function, language, and visuospatial function. So the results of the study, both those for the mini mental state exam, both those that had Alzheimer's disease and mild cognitive impairment had a lower mini mental state exam compared to the healthy control group. And this is also true for mean Mediterranean diet scores. So those that had Alzheimer's disease and mild cognitive impairment had lower scores compared to this healthy control group. And both were significant. So this looks at just breaks down the statistical significance a little more. So we can see the healthy control group compared to the mild cognitive impairment does have a little bit of statistical significance, but when we look at the healthy control group compared to Alzheimer's disease, that's really where we see that large amount of statistical significance. So overall, I thought, again, this was a really large sample size. They accounted for ethnicity in the study. They did a battery of tests, so a lot of cognition tests to really help determine their diagnosis. And then several co-founders were controlled, including age, sex. The APOE4 genotype was controlled in the study. Caloric intake, smoking, BMI, diabetes, hypertension, stroke, and heart attack. Some limitations of the study. The food frequency questionnaire really relies on data from the past 12 months, so that really has limited accuracy. And then really kind of to deal with that again, placing them in the wrong Mediterranean diet scoring. And this was an Australian population, so again, hard to replicate the results of the general population. So in conclusion, the study was a fair rating. I said that both Alzheimer's disease and mild cognitive impairment subjects had a lower mean Mediterranean diet score compared to the healthy control group. And also, this allows us to say that adhering less to the Mediterranean diet is associated with mild cognitive impairment and Alzheimer's disease. So just a quick review of the studies. So the first one, we saw that there was evidence for protective effects of the Mediterranean diet on cognitive function. Second, adhering to this diet may afford some protection against cognitive decline. And then third, the one we just talked about, not adhering to the diet as well is associated with mild cognitive impairment and Alzheimer's disease. So the nutrition relevance of this, kind of bringing it back to the beginning, oxidative stress really increases that cognitive impairment that this whole presentation was about. Antioxidants are great because they can inhibit this oxidative stress and all the damage that it causes. And the best part is the Mediterranean diet is plentiful in antioxidants to really help us out, right? So my thoughts on the study, there is limited research. Most of my studies were from 2011 to 2013. This is a topic I really like, so I really wanted to go ahead with the study, even though they are not from the most recent time. So that is one thing. I'm sure many studies are happening right now that will be coming out soon. Also, the whole diet approach, like I said in the beginning, right now they're really, in the past they have just studied specific foods and nutrients, and that really doesn't allow us to see the whole diet approach and its effects on cognitive impairment. So more studies need to be done with that. And then other factors, of course, with nutrition and lifestyle, there's other factors to always consider. So the studies need to be careful of that, and especially the genotype, the APOE4 genotype, which we were talking about. So kind of again, bringing it back to the beginning, ending with my cute grandma. From the show of hands in the beginning, there's a lot of people in this room who are either personally affected by cognitive impairment or know somebody who has been affected by cognitive impairment. So this just really shows how relevant this topic is and actually how important it is. So these are my references. And my presentation will be there. And I'm open to questions. Yes.
I have 2 questions.
Okay.
In the first study, was it 1 liter of extra virgin olive oil a week?
Yes. That is not a mistake.
Okay. But I don't know that I heard you say that that made any more of a difference than the Mediterranean diet in general. So would you clarify that for me?
So,
Yeah. Because that's a lot of olive oil to eat. I know. But I would do it if it kept my cognitive function.
yeah, so they didn't look specifically at this group for the extra virgin olive oil was combined with the Mediterranean diet. So that was one category. And then the next was the Mediterranean diet with the nuts. They didn't have just the Mediterranean diet
Right.
by itself.
Yeah. And
So-
the other was a low-fat diet.
Yes.
Yeah, so how much more did the extra virgin olive oil liter improve function?
Not much compared to the nuts,
No, okay.
but overall compared to the low-fat group. Does that
Okay.
make sense?
So not much compared to the nuts.
No, because over here.
So I can just tell my mom to keep eating her nuts every day. She doesn't have to drink a quart of olive oil.
Or stick to the whole diet approach.
The whole diet approach.
Yeah.
Okay. And the second one is, and I think, Sarah, you did some research on this, the formation of the substance when you toast grains. I want to say acrylamide, but that's not the right word. There's acrylamide, okay, the acrylamide formation and how that affects cognitive function. So in a study like this, I thought, wouldn't it have made sense if they had points off for the amount of toasted grains that you consume? Or isn't the research on acrylamides that conclusive that it would be a factor in a research project like this?
So I
don't know.
I did not hear anything about that in these studies, but I have heard of that in general. So I'm not, Sarah, you want to say something?
I guess my thought would be the Mediterranean diet, if it was followed traditionally, probably wouldn't have a lot of highly processed potatoes, right, grains, etc. They're probably going to be cooked in a way that prevents the formation of those types of chemicals. So I would think naturally.
So it wouldn't be there,
I don't think so.
except when they give people points for what they ate. I mean, I'm sure people are eating toast and chips, you know, I mean, right?
Yeah, that's true. That's true.
Good, you know, so anyway.
Yeah, like for the points that they would get, it would be for non-refined cereals. I guess chips wouldn't be included in that.
With non-refined cereals, yeah, so I'm just saying, for refined, like, they could give points off for consumption of refined or toasted grains.
Yeah, I see what you're saying.
And that might affect the study. I mean, I don't know, do you think so?
Yeah, I think that it potentially would, but that's not what the study was looking at,
Yeah,
so
no.
I guess I'm not sure.
I think it's like something that we really are needing to be considering now, right? I mean, is the research pretty strong about that?
It's a favorite topic of mine. But
Yeah.
that doesn't mean that it's just because I'm.
Well, I stopped eating so many chips.
Other questions? Yes.
Do they control for diet or any other type of lifestyle factors, or for exercise?
Actually, in the first study with the Mediterranean, or with the olive oil and the nuts, they specifically said that exercise was not promoted in this study. So they really just lived their normal lives, but I'm not sure about controlling for it. I didn't see anything.
Relating to that, the same study, did they control for or adjust for sleep patterns?
No. No. another limitation added to the list. Anything else? Yes.
How common did you come across anything about the testing for the ApoE4 or the expression of the ApoE gene? Is that, I mean, I know you have to want to know what your
Yeah.
risk is, but my understanding is that it's a really good indicator that
Yep.
would tell you what proportion of macronutrients would be best for you.
Yeah, so there is a lot of studies out there about the APOE4 genotype, and I kind of looked into them, but not specific enough. It's complicated, like, actually, and honestly, for me to look at those studies,
Yeah.
it's a very complex topic,
Oh,
so I
right.
kind of wanted to,
I know.
Just
I
say a
know you
short
have
bit
to
about
read
it.
a lot in order to choose these three, so I thought you came.
Yeah. No, I hope to in more of my free time.
Okay.
Yeah. Any other questions? Okay, thank you. Oh, yes.
I have a quick question about the questionnaires that were filled out in
Yes.
terms of if there were cognitive impairments. Did it mention anything about like family members?
Yes.
Yeah, I'm sorry if you said that.
No, so I think for two of them, the trained dietitian administered them.
Okay.
If they were able to do it on their own, then that was decided. I'm not sure how. And if they weren't, the dietitian was with family members or friends or something like that.
Okay.
Yep. Okay, thank you.